Bonjour, bonjour. Apologies there. I forgot to unmute myself. The glories of Zoom and forgetting to do things. Welcome, everyone. My name is Dr. Krista Kosterman. I am a naturopathic doctor, and I have the privilege and pleasure of leading both the science and clinical care here at DNA Company. And in short order, I'm going to introduce a very special guest tonight who's going to help me with this conversation, and this conversation really being what to be mindful of when engaged with standard care. And before I introduce our guest, before we get too deep into it, I want to ensure that people hear this conversation for what it is. Something to open your mind and keep aware, but not something to polarize us with. I think it's really tempting when we have conversations about conventional medicine and standard of care and all the fun things to throw the baby out with the bathwater and to say doctors don't know what they're talking about, or the only people that know what they're talking about. The hope and encouragement today is to understand the place of advocacy, the place of a healthcare team, the place of experts, and how all that can come together to serve your best health. It's a point of medicine and care that I'm very, very passionate about, because as a naturopath, I don't think that my medicine encompasses or can do all, but conversely, I also do not believe that conventional standard of care Western medicine as well can be the be all and end all. So this is going to be a happy in between conversation. And so on that wonderful note, I'm going to introduce our co-host this evening, the person that's going to help me have this conversation, Brandon. Do you want to join me up here?
Yep. So, hi, how's it going, everybody? My name is Brandon. I have had a pretty extensive medical history that we're going to be visiting today. And along with
Mm.
that, I am a sales rep here at the DNA company. So, if there's any type of questions regarding programs or anything like that, we can always have a conversation where I'll be able to look at your report a little bit, tell you something about that, and then we can look at different options moving forward with the DNA company.
Absolutely. So Brandon, let's back up a little bit. And for everyone's awareness, Brandon and I have already talked about beforehand what he's comfortable disclosing, not disclosing. So everything he's talking about, he's happy to share. And I'd really encourage, again, to think of this as a model of how we start asking more intelligent and insightful questions, not only about where our health is, but how we go about receiving care. Okay. So, Brandon, why don't you tell me a little bit about your health journey? Because it starts when you're just a wee little one.
Yeah, so at around 8 years old, I ended up losing my hearing to about 28% in both ears, and this was due to an audiosclerosis diagnostic, which is essentially the overcalcification of the hearing bones. Now, this happened, unheard of at that point, right? Normally, this happens in patients that are like 75, 80 years old, or
Mhm.
at least that's what I was told at the time. So it was very unusual for me to have that diagnostic. To get to that, though, I went through three different doctors, had multiple different surgeries, and it was, I mean, for an 8 year old going through all of that and losing his hearing and having to wear hearing aids and stuff like that, and then told to start learning sign language and things like that, I mean, it was pretty life altering at the time. And
Yeah.
luckily, we just happened to stumble across the right doctor that you know, used the right tool and was able to figure it out immediately, as opposed to, a year's worth of, my hearing declining very rapidly.
Yeah.
So that
Yeah.
was the start of it. Then about 2 years later, I went to get normal blood work done, and I was diagnosed with rickets, which is a severe vitamin D deficiency.
Hmm. Hmm.
And a couple years later in high school, I had to have corrective leg surgery because my legs started to bow.
Yeah,
Um,
so just to pause you there a little bit for everyone's awareness, because a lot of people don't necessarily hear of rickets. So rickets is a condition where there's a severe deficiency of vitamin D. So this can be meaning poor access to sun, poor access to supplements, or separately to that, poor access to nutrition. It's very much aligned with as well, to an extent, poor calcium. You know, the two tend to work hand in hand. They're helper friends. One goes with the other to build up our bones. So if you have rickets, it's something that you'll start mainly to see impact within the bones. So as Brandon's detailing, his legs started to knock a little bit together because the weight of his growing body wasn't able to be held up by his bones because they were not properly forming. You know, kind of think of, you know, you want your bones to be happy, strong, matrix of minerals and all this other fun stuff. And he just did not have those minerals, that calcium, that vitamin D to build those up. So he was trying to build a body on top of paper, for lack of better phrasing. And you see it start to crumble a little bit.
Yeah, and you know, a little funny story. At that same time, I started riding horses. My family had moved to Norco, so they thought it was just from me riding horses that my legs started to bow, and of course that wasn't the actual reason for it. But ultimately that led me into another life altering surgery that I had to learn how to walk again, and you know, it was right in the middle or right in the beginning of high school, so that's you know quite daunting for somebody like myself, right? And it definitely stunted my growth over time.
Yeah, I would imagine so. So that's that by itself is a lot, right? To go to the doctor and be told, first of all, you might be losing your hearing, and like your parents to adjust to that, and then very separately and almost to an extent independently, this awareness that vitamin D just isn't where it's at. And now educate me, when you were told, you know, you have rickets, was there proper follow-up? Were they tracking your vitamin D? Did they supplement with vitamin D? Like, what did they say, especially to the point where you started to see your legs going a little bit?
So when I was diagnosed with rickets, they put me on about 5,000 IU's of vitamin D daily with
Mm,
calcitrol, which is a calcium, right? And then we were checked monthly. So every month I had to go in and get lab work done to kind
yeah.
of follow it. And, you know, when I would go into my doctor's visits to do the checkups, they would tell me that I wasn't taking my medication or that I wasn't taking the supplements because, you know, my vitamin D wasn't moving at all. It just seemed like it was,
Yeah.
it didn't matter what I was doing as far as diet. I played water polo. I was outside, you know, in the sun 3 hours a day doing things like that. And it really didn't affect any kind of change in my blood work.
Yeah, yeah, which to me, so to the audience, I've had the privilege of poking into to his DNA, and when I look at his DNA, or the profile that looks at vitamin D, right? So we look at three distinct genes. We look at one that supports conversion, so helps take some of the sunlight and convert an inactive vitamin D into an active guy, right? So we can actually leverage it. So how do you receive the sun? We look at one that helps with the transport. So, you know, the skin, or if you ingest it into the gut, how is that going to be transported throughout the body to all of the tissues in your body that use it? And spoiler alert, every ounce of your body uses vitamin D, from your hair to your toes, you're there. And then the last guy is a vitamin D receptor. So namely, once that vitamin D is at the end tissue, the hair, the toes, wherever it might be, how does it connect with the receptor and effectively offer that message? You know, vitamin D is a hormone, or arguably a hormone. It's something that informs our immune system. It's something that informs all of our cells how to use DNA. It's something that informs our brain activity. It's something so vital to everything we do. And I think the really interesting thing here for Brandon, a little bit what some people wouldn't expect, is that he has a beautiful vitamin D profile. You have incredible capacity to leverage the sun. You have incredible capacity to transport it, and you have incredible capacity to receive that message. And yet here you are kind of up against this inability to shift vitamin D or calcium on any of your blood work.
Hmm.
Yeah. And what was the doctor's response to that? So I apologize. Was it he? I think you said he.
Yes, it was you.
Yeah. Yeah. So he comes back to you and he's like, you're not taking your supplements, you're not taking your medication. What
Yep.
after that?
So pretty much, you know, I got the little bit of a runaround saying, okay, yeah, you're not doing any of the things that I'm recommending. So I
Yeah.
was kind of classified as a non-compliant, you know, patient due to that.
Mm,
And you know, through working here at the DNA company as well, I've seen a lot of patients that we see have had that same, you know, conversation with their doctor where they're doing what they're saying, but they're not receiving the results. So the doctor goes and, kind of patient blames
Yeah.
as far as, moving that forward, right?
Yeah. And I without digging too much into the heart of it all, but still, like I can't imagine going to someone and saying, "Hey, I'm really struggling. I'm trying to manage my condition. I'm doing all I can." And their response effectively being, "Well, you're lying. You're clearly not doing the very basic things that I
Yeah,
already told you."
yeah,
Yeah.
it's pretty discouraging. Shortly after that, I was like, why am I even taking this if it's then I stopped taking it,
Of
right?
course.
Because
Of
if
course.
it's not moving any of the markers like it's supposed to, and he's telling me that I'm not taking it, and I know I'm taking it. It was like at that point I got fed up and I was like, all right, I'm gonna stop taking everything and just see how it goes, right?
Yeah.
And
Yeah.
that kind of led me into the next area of my life where I started dealing with like seasonal depressions, which weren't there before, because I was always in the sun growing up,
Yeah.
Southern California boy, surfing, riding motorcycles, horseback riding, everything out in the sun, right? And then when I got into college and more of my careers, I was more indoors. So seasonal depressions became a very big part of my life. And so now, I mean, I know that I need some vitamin D because I'm obviously not out in the sun enough,
Hmm.
but
Hmm.
I'm scared to take it because of what has happened before. That kind of led me to a lot of these issues. Or not saying that it is the 100% reason for it,
Hmm.
but ultimately there's something behind this all, and I want to make sure that I'm doing the right thing for this.
Yeah. Yeah, absolutely. So when I guess as you're navigating this push-pull relationship with vitamin D, right?
Hmm.
And as a disclosure for everyone, right? Like I'm not able to come here with this magical finding of we found this very rare allele and this is why we have the problem. And I want to be very plain about that, right? Our panel does not do disease-defining genes, and this is going to be really important as to the why. Because what they do is they further contextualize care and they offer guidance as to what is and is not important, especially as you think about Brandon, the individual who wants to be healthy. He's a new papa, right?
Hmm.
Brandon, the guy who wants to be an amazing father, an amazing husband, an amazing son. How do we support him versus just seeing him as someone with rickets with an unknown cause? Right?
Hmm.
Right. So when you went back to the doctors and you're like, I'm taking all this vitamin D. When I don't take it, I don't feel great. Like, what was their advice? Like, boil it down for me, kind of the quick Coles note of the different tidbits that you heard from various doctors.
Well, to be honest with you, it just seemed like it was all blanketed statements of, well,
Yeah.
that's what we see in your blood work, so that's what we can offer you at this time.
Yeah.
And that's as far as they really wanted to kind of go into it. And recently, I ended up going to a new practitioner, and they ran a blood panel on me about a month and a half ago, and my vitamin D obviously is low again.
Yeah.
So I'm faced with this challenge again of what to take. They
Hmm.
suggested that I take, vitamin D again daily,
Yeah.
but they don't suggest anything else with it.
Mm-hmm. So they haven't gone in particular, because again, I'm a little bit going back to rickets and rickets, this idea of this poor building of bones, this poor use of vitamin D when it comes to bones. Did they offer any of the other building blocks other than calcium?
No, I mean, other than in high school when I had the calcitrol, that was the only calcium that I had ever been talked to about.
Yeah,
And
so they didn't review minerals as a whole category. Phosphorus is something that contributes to bones. And I think this one's interesting because we discussed this a little bit. Did they talk to you even about K2, vitamin K2?
so I had kind of mixed matched experiences when talking to practitioners about K2.
Mm-hmm.
With the anti-clotting part of it was
Mm-hmm.
one concern, if you so that was a concern that they brought up, and that's kind of why they told me not to take it.
Okay.
But then, you read everything online and there's so much information that says that it's a positive thing to take and it should be taken with your vitamin D because it works together.
Yeah.
So it's it kind of confuses you. I don't know what
Yeah.
to do go.
Yeah, and so for everyone's context here, so vitamin K2 is something, we talked about calcium and vitamin D being workers that help build up bones. K2 is part of that in two different ways, and one way that I think is really important for Brandon here. So for the first way, kind of think of vitamin K2 like an additional worker building up the bones. Those little people that are adding little minerals to build up your bones. But separate to it, and this is really important, K2 is something that really helps with the cardiovascular system, right? So it will help actually shunt calcium away from cardiovascular system, namely the plaques that develop, that which thicken our arteries, that stiffen our arteries. It actually will siphon it away from that and put it more towards bone building, right? And so it's something, to an extent, there's studies that are demonstrating now that K2 is protective against cardiovascular issues. And we know categorically that supplemental calcium, especially high levels of supplemental calcium, can contribute to negative health outcomes, negative heart outcomes. And so this balancing factor, this little magician of K2, is important, not only for Brandon to help build up bones, but also to offer balance to something with rickets, standard prescription, vitamin D and calcium. This is an agent that would truly help those go towards the bones, as opposed to further contributing to cardiovascular outcomes. Right. And why are we pausing on this? Again, Brandon's giving me permission here, but when I look at his DNA 360 report, one of the points of the report that give me a lot of pause is the cardiovascular section. Okay. So we look at a lot of different parameters within this section. We look at how likely are you to developing high cholesterol? How likely are you to develop high blood pressure? And how likely, we look at this one part of the genome called 9p21. We look at 3 different SNPs, or 3 different pages, if you will, within the gene, and we use that to establish a risk. So there are certain people with some profiles that if they have a presentation of this gene, namely 4 to 6 G alleles, okay, it means they're at a greater risk for cardiovascular event. Okay, and so these are people, it's not fated. Very few genes actually fate you any which way. It's not fated, but these people need to be exceptionally mindful and proactive when it comes to their cardiovascular wellness. People with this genotype, the poorer genotype, and spoiler alert, Brandon is part of this poorer genotype. People with this poor genotype, they're more at risk for heart attack, stroke, a large contributor of that clotting, a large contributor of that hardening of arteries and vessels, right? Loss of that elasticity. And so when I see this report and I see that he's on these incredible amounts of D and calcium, not buffered by a K2, not supported in other which ways, right? And that's 9p21. That was the little guy I'm referring to. To me, it gives me pause. It's not to say don't take D, don't do what the doctor's saying. It's saying, well, what else are you doing to address this very salient risk? Right? And have you had those conversations with your doctors?
Um, to be honest, no, because I'm only 27 years old. It seems like that conversation isn't until we have a problem.
Uh,
Um,
Agreed.
and and that's kind of the worrisome part of it, right? Like as more people get healthier at younger ages, it seems like the medical, you know, wellness, or not the fitness and wellness, but like the medical space hasn't gotten with the younger generations yet. They're focusing more on the older generations that have already had the issues. So the
Yeah.
preventative side of things hasn't been a big conversation with any of my doctors. Uh,
Yeah.
and then knowing my grandmother's, medical history, I mean, I definitely don't want to be on her pathway that she's on. And, just to speak a little bit about my grandmother, and of course I have, the okay to talk about this as well. She ended up doing a DNA test with us, and, we've gone over her report. She went through one of our programs and had tremendous success through it. But ultimately, she's had 6 heart attacks and 7 stents put in. She's going to have another stent put in another, like, the end of this month. And she can't really live her life the way that she wants to live because of these medical issues that she's having.
Absolutely.
And what we've been able to do with her through one of the programs has been we lowered her blood sugar a tremendous amount.
Hmm.
She's been able to now increase her walking because she gets out and gets sun, so her depression
Yeah.
has started to alleviate a little bit. She had a major anxiety piece that was kind of pushing her to eat more than she needed to be eating,
Yeah.
and all of these things were kind of working together. And because she goes to a specialist for each one of these medical dispositions, they don't work together, and you end up with different, you know, recommendations from each person.
Yeah. Yeah.
So the nice part about the DNA company is that we take a full body approach to this, meaning that we look at multiple different systems, multiple different sections of this report, and kind of piece it together, with you, right?
Hmm. And in the larger context of a cohesive medical plan, I think it's really important when people receive our results, it's meant to bolster the overall approach to health. And it's not to say disregard the specialists because they don't know what they're talking about and they're looking down, your health that only one way. They have a lot to contribute, right? They have studied that pathology, they know that pathology, they know what supports it. What they have not studied and what their blinders are not allowing them to see is the larger picture, right? And here I would offer is really where this proactive integrative medicine comes in, right? Sitting with people, understanding what you, Brandon, as a father, as a husband, as a son, as a man, as a person, is seeking from life, and
Mhm.
how do we go about supporting that with awareness that there's something funky going on with your rickets,
Exactly.
right? Right? Like, yeah, yeah. So, and so have you I guess, are you leveraging us as your kind of checkpoint of care, or have you started to bring some of this information back to your other doctors? How are you personally going about incorporating it all together, right? Because it's a lot. Let's be plain. Getting all this stuff, competing information, and then, the doctors being like, yeah, good luck, it doesn't count. How are you balancing it all?
So yes, it's definitely been a balancing act, that's for sure. And the more and more you kind of, I like to call them rabbit holes, where
Mm.
you start looking up one thing, and next thing you know, you're 9 miles down the road, the opposite direction where you needed to go. And like I said, I talk to a lot of patients that have a similar feeling with this.
Mm.
It's There's so much information out there now, and we have so much readily available information, that it's really helpful to have somebody that's on your team.
Yeah.
And my experience with it with my practitioners has been kind of the opposite. Not with the DNA company, of course, with my normal practitioners. It's been the opposite, because I even tried to offer the test to them and show them, and some of them have been okay with looking at it, but they really don't know what to do with this information now.
Yeah,
And
that's
then other ones are like, well, I was kind of taught with this blood panel that I use for all of my patients, and that's about as far as I'm going to go with it.
yeah.
So it kind of leaves me feeling like, okay, if I'm paying for a practitioner to help me out with these things, why don't they want to use more information about me? Right? This is exactly how my body is wired to interpret things and how to use these nutritions and do different things. Why wouldn't we start with that instead of kind of doing the guess and check method, right?
Yeah, yeah. And I would also start with it, especially in that proactive sense. I think you made a very, I would offer it as a haunting statement, right? I'm young, and so my healthcare, it's not that it doesn't count. That is not what I'm saying at all. I'm young, but we don't need to worry about things like that. And yet we now know, based on the beautiful of science, we have access to things that kind of can say, if you're not doing the right things, we know the road you're going down. You have an unfavorable 9p21. If
Mm-hmm.
you were to live a life that is not attentive to your cardiovascular health and well-being, you greatly have increased risk of event, right? And now is the perfect time for you to be addressing that and to be thinking about it, especially in the context
Mm-hmm.
of rickets and in the context of there's something funky going on with your vitamin D and the way you absorb it,
Yeah.
right?
Yeah. And yeah, and so it's for me the biggest thing that I've been able to leverage with all the information that I've learned from the DNA company is take a monitored approach to
Mhm.
some of the healthcare recommendations and
Yeah.
make sure to get a second opinion because
Mhm.
they are valuable. And alternative, medicine is a very good way to kind of checks and balances some of the normal day-to-day medicine that you run into, because it can help you understand things that weren't there before that we can leverage, right?
Yeah. And I would offer, instead of the phrase alternative medicine, I think the phrase that I'm starting to advocate for is more collaborative medicine, right?
That's a
Because
perfect way to
because I can sit very humbly. I'm not a cardiologist, nor am I someone that studies bones. And if you were to come to me with what you were saying just as a primary diagnosis, I would say, hey, happy to work with you on the general picture. Let's also engage specialists who know about this. Because
Yeah.
in my opinion, medicine should be a collaborative effort, right?
Mhm.
I look often at how we're training new healthcare providers, and a really big paradigm shift, or at least the more successful people that come out of various medical trainings are the people that are learning to better collaborate, both
Mhm.
with peers as well very separately with all of this incredible amount of information that comes out, right? Like, um, I have been very fortunate to have a lot of time and thought and study around genetics, but I never claim to know it all. It intimidates me when I go into PubMed or Google and understand how much was just discovered yesterday, let
Mhm.
alone in the past year. There has to be this perspective of the knowledge base is always growing and the power is in collaboration of you and your provider, right? Your provider never coming back to you and saying, you didn't take your vitamin D, you're not compliant, this is all your fault,
Yeah.
and collaboration of a doctor saying like, cool, I don't understand what any of this genetic stuff says, but maybe we can work with someone who does.
Yeah, and that's kind of the direction that I'm looking to head now. Um, no, I would love to get into one of our programs, and I obviously I have my functional genomics practitioner certification, but I'm not a doctor. I'm not going to pretend to be one. And working with the lovely practitioners here that like Dr. Krista Kosterman here, and it kind of relieves the stress knowing that there's somebody here that's not just gonna stay within their wheelhouse, and they're gonna try to broaden the horizon, take that step back, and look at me as a person instead of your next appointment, right? And have a conversation with me and figure out, am I eating the right diet that I should be eating that supports all of my genes, or am I eating something that maybe I should be cutting out because it's going to push a risk to a lot higher of a level for me.
Yeah. Can I ask you a nasty question on air that I haven't asked yet?
Of course.
All right. Do we consume wheat?
um yes, we do. We do.
Okay. Okay. Do you know what's going to follow now? You might be able to predict it.
Probably, go ahead.
Yeah. And again, just since you kind of led me down the path of where does this go, for you, looking at your genome, so both from a perspective of we look at a gene, it's called the HLA gene. We look at it with the curiosity of, does this person have a risk towards celiac? Does this person have a risk towards gluten sensitivity? And very separate to this, we also look at a few of our detox genes, right? Because when one consumes gluten, rarely is it just the protein gluten, usually it's the whole plant. And the whole plant, unfortunately, based on the way that I'm going to say this purposefully, manufacture our wheat. We do not grow it, we manufacture our wheat.
Mhm.
But based on that, unfortunately, there's a lot of things that the body must detox when it consumes. And so when I look at you from both perspectives, the perspective of, is gluten the protein okay for you? And then the perspective of all the accoutrement, all the biotoxins that come alongside wheat, are you okay for those? And unfortunately, on both things, you're not. Right? Is this causing you rickets? No. But is it aggravating your picture, in particular your gut, where you should be absorbing some of the supplementation, some of the minerals, some of the minerals that you need to build your bones? Is it aggravating that? Possibly, maybe you want to play around with, and again, we're offering on air, but something you could consider is, right, an elimination diet that takes that out for a while. And right,
Hmm.
and again, this is not me offering a fun example. My religion is croissant. I hate offering that people should not consume croissant or wheat.
Hmm.
But it's a curiosity, right? Because we want you to achieve that betterment as a papa, as a husband, as a son, as a man, and as a person, right?
And it's definitely something that I've considered after reading through my report. Up till date, I've been on what's known as the seafood diet. You see the food and you eat it, whatever it is at that point. But yeah, no, and speaking about the gluten sensitivity, even in a further aspect, my grandmother's diet, because I've had so much experience watching her, and I grew up with
Mhm.
her. She's a very big cooker.
Yeah,
Italian background from Argentina, so primarily pasta, red meats, red wines,
yeah,
things like that. Um, Apparently, she's gonna be more celiac, and
yeah,
this has been something that she's kind of ignored her entire life. And even
yeah,
recently, like last week, I was talking to her about it, and she's still eating bread, she's still eating all these things, and she told me the other day that a tortilla almost closed up her throat.
yeah, yeah, yeah. It's
So.
with my dad's given me permission. My dad went through the same thing. And again, like a very, very staunchly Eastern European man. And like bread comes with absolutely everything. And bread, bread, bread,
Mhm.
bread, bread. And, doing the convincing to be like, why don't we play with this? Why don't we take it out for a while and see how we do?
Mhm.
His answer to me was absolutely not. But thank goodness I'm his daughter and he listens to me eventually because that's the way fathers are sometimes. He took it
Mhm.
out and he's like your grandmother. There's almost an instantaneous reaction now that his body knows what life is like without that. And again, I think too, does that fix your rickets? No. Did it fix my dad's other medical concern? No, but it made it so much better because his body that had genes that negatively react with that sort of stuff, i.e., a body that negatively reacts, when you take away that burden, the body can better support and better work towards other things.
Mhm. And one of the conversations that I find myself having is a lot of people tell me that they're on a very clean diet or very
Mhm.
well-rounded diet, and they buy everything from their organic whole food sales, whether it's a farmer's market or the grocery store, whatever it is. But then they really don't know what the deficiencies are in that diet that they're trying to support.
Yeah.
And having that idea of what type of minerals that I need to be including into my diet, and kind of just that broad spectrum view of what it is that I need, can
Yeah.
really help me kind of guide myself. Maybe not in something that I'm looking for an exact recipe or exact viewpoint of I need to be eating XYZ, but more of
Mhm.
a guideline of how to live my life kind of outside of the bubble, right? When I leave the house, what's my diet going to look like? When I go on vacation, when I visit family, right? And
Mhm.
that's another a big thing that helps a lot of patients out that I've gotten, kudos from,
Mhm.
from our practitioners team, saying that, you know, patients that have gone through a program that have been able to kind of start living their life a little bit less restricted in a way, but
Yeah.
with a lot more information behind their decisions.
Yeah. Yeah. I like to practice personally, and this will sound weird at first. I like to practice lazy medicine. And
Mm-hmm.
what I mean by lazy medicine is I want to do as little as possible to get the most results. I want to
Mm-hmm.
be as lazy as possible with my healthcare. So, but to the end of still staying very healthy, because that's a value of mine and that's something I invest a lot of energy and effort to. And so I find not only having genes, right? Because genes can focus where are we investing energy and effort. If you have poor cardiovascular genes, we should be investing energy and effort there over maybe something else. But
Mm-hmm.
I think separate to that, having someone to take all the information in, to sit with it, and to say, not just your genes, but you as a person, you as your goals, you how you're presenting, how your life and your experience to this point has brought you here.
Mm-hmm.
Here's what we can do to best support you, right? And
Yeah.
yeah, I admire your perseverance here because I cannot imagine as a teenager, a doctor being like, shame on you, this is your fault. And I'm heartbroken that was your experience. And I'm so grateful that you got past that because I don't think everyone per se would. And I'm grateful that you're still here and engaging with healthcare providers.
Well, yeah, of course. And you know, to be honest with you, I shied away from healthcare professionals for years because of it.
Yeah.
And it's just because once you lose faith in the system, it's like, how do you come back to something like that,
Yeah.
right? Unless you have some kind of an emergency, that'd be the only reason why I would go back, right?
Of
And
course. Of
and
course.
it's really nice to see and hear from patients that have gone through programs with their practitioners and things like that, that they're not getting that type of, you know, like I'm not getting the negative feedback from any of the patients that have reached out to me on, you know, on behalf of the practitioners that they've worked with here at the DNA company. And it's just, it's really nice, and it's heartwarming to hear that, right? To see
Yeah.
that we're kind of evolutionizing this health and wellness space into more of, like you said, a collaborative type of medicine
Yeah.
where, you know, there's more than one set of eyes that are looking at you,
As
and
there
there's that
should
whole
be.
conversation. You know,
Yeah.
everybody is so unique, and your individual settings of where you live, what you eat, your genetics, I mean, all of these things come into some sort of a uniqueness factor, and you should be treated that way.
Yeah. 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 No, no, no person should receive the same plan, save and except for sleep a lot, eat well, and rest, right? Like, I mean, those happy generic terms, but for each person, what that looks like is a little bit different. And I think we're very fortunate within this period of time that we have access to genetics that can help guide that, but also separately, and to your point, practitioners that are kind of recognizing it needs to be a team effort, recognizing it's going to be people collaborating to an end. Because do I have a magic gene that says why you have rickets and vitamin D issues? I wish I did. I wish I did. If I get a wish, I'll let you know how it goes. But separate to that, I know that, without that, and it doesn't sound like that exists right now, kind of that persistence and that encouragement of please stay in touch with healthcare providers and please continue to champion for your health
Mm-hmm.
in spite of what a few bad apples might have to say. I'm glad the bad apples didn't win because we're very grateful to have you and the team here at DNA Company.
And I love being here. I wouldn't change a day of this. I love talking to everybody that I talk to, and you
Mhm.
know, it's so nice to hear all the unique stories and everything that everybody has been through.
Yeah.
It's just amazing that a lot, you know, some of the heartfelt stories are a little bit difficult at times to hear, but
Yeah.
you know, it really
Yeah.
does kind of put wind into the sail of, you know what, there is another option, and there is ways to, you know, maybe not the exact right way is, there's not only one way to do things,
Yeah. Yeah.
and that's a nice thing to be able to see and to be a part of.
Mhm. Yeah, I think what we'll do now is we're going to open up the floor for questions and answers, and but just kind of on this note of Brandon, like I think it's unfortunately an all too common tale for people to say, I went to a practitioner and I was blamed, or I was ostracized, or I was this, or I was that, right?
Mhm.
I was too big, I was this color, I was this gender, I was this, that. Um, we endeavor to offer care to everyone independent of all those things, and we're not going to sit there and say it's your fault
Of
because
course, of course.
it's not. You just haven't had the proper support and the proper collaboration to date. So um yeah, thank you for entrusting us, Brandon. And for those that are considering it, please know that we're going to be a space where we hear you and see you and support you with wherever you are at, independent of what previous practitioners have deemed you or told you it's your fault. It's not. So on that gushy note, let's jump into some questions and answers. So yeah, all righty. And you'll have to, everyone on the call, just give me a second because I like to read the question. I'll repeat it and then we'll dig into it. Um, mhm, Okay. So Janet has asked a question. She asks about standard of care for breast cancer treatment. Why is it automatic to place a patient on tamoxifen or the like without first measuring estrogen levels, especially those who have already gone through menopause? So two answers. It's standard of care largely because there's a salient body of evidence that suppressing estrogen, suppressing other certain hormones, will reduce the risk of reoccurrence, especially within that first 5 years. And that's kind of the concern. So that's why that's the default. Historically, and I say this like even when I did some training in adjunctive cancer care. So even 8, 9 years ago, I don't do time very well. Whenever I did that training, it was almost default. You just kind of offered it. The beauty of what's starting to happen now is there's things called pharmacogenomic tests. And so I don't think tamoxifen is ever going to be unearthed as a standard of care for the foreseeable future. But there is at least energy and effort put into pharmacogenomic testing. So is tamoxifen appropriate? Is it actually going to be effective and helpful to you? Right. And as well as I think, just you as an empowered patient, right? Having that conversation with your oncologist and asking the question of, what does it look like if I do this intervention? What does it look like if I do not do this intervention? Because I would offer all of healthcare as just a balancing of risks and whatnot. So I would offer, why is it the standard of care? Salient body of research that supports it, but that being a very unpersonalized body of research, right? There's a lot of people in those studies that couldn't take tamoxifen because they don't have the genomic paneling for it, right? And so it's always going to be a conversation of, how do I know if it's the right agent for me? What happens if I do it? What happens if I don't? Yeah, that's unfortunately the blanket answer there. The next question I have, so there's a question, a fellow, a male is mid-50s with benign prostate hyperplasia, so BPH, enlarging of the prostate. And they say that taking vitamin D worsens symptoms, namely makes it more difficult for urine to pass. So when the prostate's big, can't get pee out. What to do or what to take instead. So the tricky is that like there needs to be labs examined and other such things, right? Because I'd be curious where you're at in a vitamin D sufficiency, where are you in regards to geography? Do you have access to be out in the sun? Do we need to necessarily be supplementing? I'm not trying to put off the question. I would just offer it that kind of takes a very nuanced intake, as well as really playing with dosing, playing with timing, right? There's some genes that will indicate how well readily you absorb. And if you're not great at absorbing, perhaps like dividing doses or, just simply microdosing, right? Like we need to look at sun exposure. There's many different ways because supplementation isn't the only way to be getting vitamin D, right? And as well, we need to know how you're being tracked, how are your levels being tracked, etc. I know that's a bit of a non-answer, but I hope it at least spurs some questions to be asked, right? And possibly also looking, especially working with naturopaths or other people who are trained, especially in supplementation, looking at other agents that can complement the vitamin D, because perhaps it's just an unbuffered agent that's causing the issues there. All right. The next question I have here. So this person presents with a very specific medical history. They have an essential thrombocytosis. There we go. I struggle with words a lot. And it sounds like this person has already been genotyped insofar as they know the gene abnormality that is causing this. They're being supported with chemo. And that there's quite significant side effects here. Yeah, so the question is, they're experiencing a lot of side effects from chemo, which people often do. And then there's also concern of the risk for stroke, etc., asking if the DNA test and recommendations would help this person. So two answers. First, Pat, I would definitely recommend a pharmacogenomic test, PGX. This would look at the specific type of chemo this person is on and does it mesh well with their genes, right? So I would first and foremost say that maybe we can find another agent that incurs less of a side effect profile. Separate to that, though, if we're looking at just the DNA 360 and kind of all these towers that I walked through with Brandon, so cardiovascular, sex steroid hormones, a few other, the reports that kind of look at general wellness, I would offer this would absolutely be supportive in regards to what other things do we need to be concerned with? How are you detoxing? How are you recovering? Detox and methylation, I think in particular, would be two sections that would be interesting, that really part of the general wear of chemo, right? It doesn't attack just one thing. It's a systemic attack unless they're on a more advanced targeted chemo. But of consequence to that, the entire body is fatigued. So really looking at systems within the body that support repair, really looking at how is absorption happening, how is digestion and absorption happening, because again, especially if there's a lot of tummy ache and not wanting to be taking in food, having nutrition is really important. This is specific to cancer, not what you're referring to here, but one of the bigger predictors as to the success of chemo or radiation really is nutrition. Can the person maintain a diet that keeps their body able to repair the damage? So those would be my first two thoughts. I would really recommend, though, given the nuance of the case, if you were to be tested in either which way, working with a practitioner to properly implement those results. Okay. So Brandon, this is a question for you. They're asking if you've had a comprehensive blood panel done.
Like I said, about a month and a half ago, I did have a blood panel done, but I haven't done much with it since then. I've been kind of sampling vitamin D differently with K2s, of course, now,
Yeah.
after getting the report and talking to Dr. Krishna about this.
Mhm.
But I haven't gone any further with the blood panel. So I'm going to be doing another one probably in another month from now, uh,
Mhm.
just to kind of check where I'm at and see how this is showing up in my blood.
Yeah, yeah.
Um, but
And I think,
ultimately, I
yeah,
mean,
I had a
that's
few suggestions of ads, right? Some thyroid stuff. And I think also, really having someone monitor electrolytes and other evidence of like calcium and phosphorus and a few other things we know to be, and potassium, things to be involved here.
of course, of course.
Mhm.
And yeah, so no, I don't know that I've had a comprehensive blood panel done since then, at least. Short answer.
Yeah, and I remember, I think too with blood work, and I really like that you are saying, I got this done and I'm going to do it again, because I think to very much like, you know, um, a blood test can kind of be a point in time speed. How are you doing right now? Yet a series of blood work speaks to velocity. How is the trip going? Is it smooth? Is it slow? Is it fast? And that tends to be the power, right? To continually check in and see how body is responding. Because to your point, you were continually supplementing. And if you didn't test for your vitamin D, you would have thought you were fine. And
Exactly.
here's the doctor telling you you're not doing what you're supposed to do. Yeah.
Yeah, and it does speak to one of our new offerings here with our Black Label supplements, being that if you are in one of our coaching programs, it does come included in there, a 3 month supply of it at least. But there's a custom compounded supplement that is now available, which hasn't been available till now, really, where you're getting all your vitamins and nutrients that you need based on your report put into a single pill. So it's like a customized or bespoke multivitamin that's unique to you
Mhm.
with your height and weight set to the right dosage. And it takes a lot of the guesswork out for supplementing. And the only reason I bring this up is because Nina brought a question in with if I'm supplementing with magnesium. No, I'm not. And that's why I'm like, I don't know exactly what I should be taking. If I start going off the shelf with some of my supplementing, I could be taking a lot of a higher dose of something that could be giving me you know,
Mhm.
the wrong results, right? I don't want to push a risk that doesn't need to be there. In
Yeah, and I think
to
that's valid, right? You don't want to get your medical advice from Dr. Google, and so we'll have to make sure we set you up with a program here and set you up with support so that you have someone interpreting and supporting the next steps as opposed to it being Dr. Google. Yeah. We
of
want,
course.
yeah, we want the new bebe to have a happy papa. Yeah.
Yep, yep, yep. And to speak on that as well, I think it's very powerful to have our children do this test, because it can offer parents a huge leap forward in understanding what they're going to deal with their young children, right? Like, had my parents have known this vitamin D issue would have been how it had been playing out in my report, I could have definitely taken a different, approach to this rickets diagnostic. And maybe, obviously you can't define anything, but maybe I wouldn't have had the leg bowing, and maybe I wouldn't have had my growth stunted like it did. So there's a lot of benefits in truth to having all the information about you. When you go and buy a new computer or anything, you research everything. But then you go to the doctors and, you don't really research anything beyond what, like Dr. Chris was saying, Dr. Google.
Yeah.
What is everybody else experiencing? But that's not you.
Yeah, 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 yeah. No, yeah, yeah. I won't say more about Dr. Google. It's is a friend and a foe. All
Exactly.
right. I see one other question left in the Q&A section, and just for awareness, we do have a hard stop at 7 my time. I'm not sure what time it is for others, but in about 5 minutes before we bid you adieu. The last question I see here, Deborah, she signed up for one of our programs, and she's asking if there's certain lab tests that you prefer to see. So depending on the program, Deborah, so one of our programs, the longevity program, comes with a blood test, and so I would recommend that. Otherwise, I'd say, collect from your doctor whatever blood work you have to date. Often they'll offer an issuing of records. If it's just standard blood work, as in you're not tracking a specific condition, usually just blood work over the past year is good. And then you can work with your provider to understand, what are you trying to improve? What are you trying to do? And that can dictate some of the blood work. I wouldn't suggest getting it done on your own beforehand. And the reason is, let's pretend that you're tracking something, a very specific medical condition. We'd want to include that on the blood work, and you may not know to include that. So we don't want you having to go do two pokes when you could have just done one. Yeah, so that would be my thought. But collecting up what you already have, asking that question, and then going to get the requisition, be it from us or your family doctor. Yeah. All right. Well, I hope that's helpful and thoughtful. We really, really appreciate everyone that's jumped in today. We really appreciate people that are starting to take more of a driving seat within their healthcare. And as a healthcare provider, and I acknowledge I'm trained as a naturopath, we're trained a little bit differently. We're really trained within that conversation and the art of taking in the story and seeing the person as a whole as opposed to a condition. I would offer there's still a lot of other practitioners, medical doctors, naturopaths, other practitioners out there that have a similar collaborative passion. And so if you're coming to us, very much in a space where people have, told you it's your fault, or I can't help you, or whatever the story is, please don't surrender to that. Please don't give up on your health. There's a lot of care providers that care so deeply and are willing to work with you wherever you might be coming to us from. And we may not have the answer, right? I don't have a magical gene that I can offer Brandon here, but I can offer larger context, and I can offer, how do we support your health as a person and not a condition? And so please, if you've been told it's your fault and go away because you should be doing what I say, just ask for a second opinion. Second opinion should be encouraged. Don't go shopping for medical opinion, but encourage second opinions. So thank you everyone so much for joining us tonight. Brandon, thank you so very much for sharing your story, because it's not easy to get up here in front of 100 or so of your new best friends and be like, guess what? And open it all up. So thank you so very much. I really value the persistence you have, not only in your own healthcare, but advocating for others.
Of course, of course. Thank you for having me on here and all the useful information, right? It's definitely opened my eye and my family's eye pretty much to a whole new world of information about myself and
Yeah.
everybody else that, just wasn't there before.
Yeah.
And that just shows how much further we are in the health and wellness space. And if anybody wants to have a conversation with me outside of this, my booking link has been put in there a time or two in the chat or in the question and answer area, or you can directly reach out to me, and I'm happy to have a conversation about whatever it is that you have going on, and I'm going to help you choose which program is going to get you the best for your needs, right? I want to make sure that everybody is getting the assistance that they need at the level that's going to benefit them the most, right? So
On that beautiful note, thank you for what you do, and thank you to everyone here who's joined and willing to take more of an advocate role for their own well-being. And I hope that we can co-advocate with you and collaborate with you and find that best space. So
of course, thank you.
on that beautiful note, thank you so very much, everyone. Have a lovely evening, afternoon, whatever time zone you fall within. Au revoir.
Bye bye.
Thank you everyone for joining, and we'll be sending out a replay once it becomes available. Thank you.